Good afternoon. I'm Jeff Oxendine. I'm the founder and president of Health Career Navigator, also the Associate Dean of Public Health Practice at UC Berkeley School of Public Health, and the president of Health Career Connection. And it's my pleasure to welcome you to the first in our webinar series on graduate education in the health field. This one's called Demystifying Graduate School and Health Administration, Management, and More. Some of you may recall that we had a webinar series last fall on graduate education, and if you haven't seen that, I encourage you to review that. We have a new series this fall really designed to help you to figure out the best graduate school option for you, to know how to be most competitive, and to really strengthen your chances of getting in. So I'm going to be going through a PowerPoint slide and having a discussion where we will be having ample opportunity for question and answers at the end, because we really want to make this something that is practical and useful for all of you. I will remind you that you can submit questions via chat, and just go ahead and submit those on chat, and then we will get to as many as possible at the end. We also have a poll that will ask you 2 questions, and you can go ahead and answer the poll, and then we'll be able to know who's here in the audience, and that might help us to be able to help me be able to tailor my comments a little more to your needs. So with that, thank you for joining us, and we're gonna jump right in. So the overview of the presentation is going to be, first of all, we're going to talk about why go to graduate school to work in the health field, when, what do you want to do afterwards, which degree program in school, and how to best compare to be most competitive. While I'm speaking, I'm going to go ahead and just have you focus on the PowerPoint slides rather than me, and then I'll come back when we have the question and answer. So, first of all, sorry, we're having a little technical difficulty here. So first of all, why go to graduate school? And particularly those of you interested in public health or health administration, health policy and management, why go to graduate school in those areas? And there are many reasons to go. But some of the most important ones for you to consider, and you really need to ask yourself this question before you apply. Why are you applying? And as I have thought about this over the years, I've broken it down to really 5 things that you get out of your graduate school experience. And really, graduate school is about specialization. Undergraduate is also somewhat about specialization in your major, but graduate school is much more so in that way. It's a major investment of both time and money, and there's also an opportunity cost for you not working and earning income while you're going to school. So it really is, it's just an opportunity to make sure that you are getting the specialized knowledge, the skills, the credentials, the kind of relationships with faculty, with alumni, with employers, with communities that can help you go forward, and opportunity. Opportunity not only to develop all the things that the knowledge, skills, credentials, but also opportunity to get connected to the kind of work that you want to do while in the program and afterwards. So it's very important to really know what you want to get out of the program in these areas before you start looking at schools. Hopefully, I think very importantly, that this specialized knowledge, skills, credentials, relationship, and opportunity should be aligned with your authentic life and career direction and goals. So first, you need to really think about what you want for your life. Secondly, your career and what your goals are related to both of those things, how you're going to integrate them, and then how does graduate school enable you to be able to achieve those, and how does the experience of being in graduate school contribute to those things. Also, it should improve your ability to advance and be effective in the field, really the type of professional and leader that you want to be. Hopefully, as a result of being an effective leader and doing the work that you want to do, You'll be able to generate greater income as a result of going to graduate school, because you'll be able to be qualified for higher positions with more responsibility, more complexity, more impact, and hopefully you'll be able to have greater impact as a result of your graduate education. And also, just going to graduate school it's a life accomplishment to go to graduate school, and it's a great life experience. And you should keep that in mind when you're thinking about which school, program, and degree to go for, and where to do it. So these are some of the reasons about why to go to graduate school. Why not to go to graduate school are things like I don't have a job, I don't have any other next steps, so why don't I go ahead and stay in graduate school or go back to school if I'm not sure of what I want to do, and if it's not really aligned with what you want to do, because your friends are going to graduate school. They may have different career and life goals than you are. They may be at different points in their readiness and their competitiveness, but because your parents want you to go, or because your parents will only pay for it if you go to graduate school now, that's not a good reason to go to graduate school, because the economy is not great. I mean, you should go to graduate school when you know what you want to do and when you're ready to go, and when it will kind of get you, when you're sure it will get you to where you're going. We'll talk a little bit more about that. So why go to graduate school in health policy and management? One of the things we're going to talk about in this webinar is specifically about health policy and management related options, although many of the things we talked about for that will apply to other aspects of public health. And why go to graduate school in health policy and management? It's that basically it is to obtain higher level management or staff positions. Oftentimes it will help you skip some levels in the organization because you have obtained a master's degree. In my case, when I came out with my MBA and Master in Public Health, I probably skipped 3 levels of the organization than if I had tried to go in and work my way up 3 or perhaps 4 levels. It helps you really build the necessary management or policy or both competencies to be effective, and that can either be somebody who's working as a healthcare manager, or somebody in health policy, or someone who's a clinician, either a nurse, a physician, a pharmacist, who wants to build management or policy skills in addition to the clinical skills that they have in order to really meet their goals and be effective. It's a chance for you to transition to different kind of roles. In health policy management, there often are people who started out in research, for example, or in something like pharmaceutical sales or clinical trials or something like that, and they're saying, gee, I've done that for a while, maybe I've developed some good management skills in doing those roles, but now I'm ready to transition into more of a formal management or policy role, or somebody coming from a community background, or somebody coming from medicine or nursing and wants to really exclusively focus on management. It's also a chance to position you for long-term advancement and senior level roles. Many roles within health organizations, roles such as executive directors or presidents or chief operating officers, those are roles that require a master's degree, and by getting a master's degree in health policy and management, it positions you to, over the long term, as you gain greater responsibility and experience, to get to those levels. The key is it also helps you develop some transferable knowledge and skills. The health industry is changing rapidly now, and while you might be interested in working in a hospital, initially things might change, and you might decide that you want to go into a community health center or a startup organization or a health department. And in health policy and management, you really get core skills in management and policy that can be transferred to other types of health settings. And so I think that's an advantage of getting this type of a degree. It's content that you get, but a lot of it is really transferable to a lot of different kinds of settings. It's also a foundation. Those of you who may not want to be in health policy and management as your primary day-to-day job, it is a foundation for understanding how health systems or and the health system overall and how health organizations function and what's needed in order to really make the kind of change that going forward to improve health and reduce costs, those kinds of things. also just to help you develop into a more effective health leader, regardless of the path that you're going in. So those are some reasons why specifically to go to graduate school in health policy and management. So those are why. The next question is when to go to graduate school. And I feel like it's really important that you know your career, your health career direction, and you know that. And by the way, I'm using the knowledge, the KSCR as and should be an O there. The knowledge, skills, credentials, and relationships and opportunities. I'm using that as a way to not write that out every single time. But you should really know what direction you're going in and what you need to be there. That's one key criteria from my perspective of when to go to graduate school. Also, where you've reached a point where you can advance to the next level of responsibility without it. And that's oftentimes something you'll find when you're working in a hospital or a community health center or a health department. You will find that, hey, I've been here for 3 years. I've done some great project work. I'm managing some people and some budgets, or I'm working on some really cool initiatives. But gosh, I think I need some more knowledge and skills around how to manage and supervise, how to be responsible for finances, how to come up with evidence. Whatever it is that you'll know it when you get there. And also, you just might need a credential. Maybe I need to have that master's degree now in order to get the next level. Hopefully, you'll know what you want to get out of graduate school, and you're specific about that. And it helps to have, in order to know what you want to get out of it, it helps to have sufficient life and career experience before you apply. And there are many benefits in addition to knowing what you want to get out of it that you will probably make a more well-informed decision. I have a lot of examples of students who come to me after they've worked for 2 or 3 years, and they say, geez, Jeff, I would have, if I applied right out of school, I would have applied for the health and social behavior program or the public health nutrition program because those were my interests. But now I went to work in those areas, and I found that while I'm still interested in the kind of content that those programs offer, what I'm really good at and what I really want to spend my time on every day are more the health policy and management related issues. And so I'm glad I had that experience. Now I really know. Also, it helps you to be more competitive. And I can't emphasize this point enough that health employers are more and more looking for graduates from health management programs, whether it's an MHA, an MPH, or an MBA, or a dual degree. They want people who have work experience first. And I'm finding that the students I have here at Berkeley, they're really amazing students, if they didn't have paid work experience after undergraduate, they are having a very hard time even getting an internship in their graduate program, let alone getting a great job afterwards. That's why actually at Berkeley now and at Harvard and many other programs, there's a 2-year minimum experience post-undergraduate required before you can apply to a program, because we're just seeing that employers really are looking for that. We also have found that students can contribute more when they're in, if they have more career and life experience. They can be more effective in group projects. They can be part of things like at Berkeley we have a really exciting Center for Health Leadership Fellows program that really expands your leadership and career skills and development. But it's hard to be competitive for that if you don't have experience first. So there are so many reasons why having paid work experience and life experience before you apply to school is important. Also, the better that you do in terms of your getting more work experience, in many cases the less critical that your GRE scores or your GPA or some of those other factors will be, because they're going, wow, look at the experience that this person has that they're bringing to the table. Finally, I just think people who have more experience oftentimes they feel more comfortable in the program, and you feel more like you have a lot to contribute when there are case studies and different kinds of projects that are thrown at you. It really helps to have experience to go, wow, yeah, that's similar to where I worked. This issue came up, and here's how we addressed it. Another time when to go to graduate school is when you're ready. and when you think that you're competitive to get in to the program that's the best fit for you. I guarantee there are many of you that can get into programs without paid work experience and without the best test scores you can get, and without some of the other qualifications that you might develop, and you're kind of in this mode of, hey, I just want to stay in school, which is another reason why not to go to graduate school, just because I want to stay in school. I don't want to lose momentum, which is something I hear all the time. But I'm telling you that you'll be less competitive to get into the top programs if you don't have enough work experience, and you'll be less likely to get a good job afterwards. I have a student who came to see me a couple months ago who had been out of school for a good 9 months, and he went straight through, and he went to a pretty reputable school, but he still hadn't found a job. He was volunteering, and he was working on it at a really low paid basis, doing some entry-level work just to keep himself in the mix. You should go when you have the motivation, when you have the energy, when you have the capacity to do it. Sometimes you might need a break, but before you go, you really have to be up for it. It's a big undertaking, and you should go when you're positioned to take full advantage of it. That's my feeling, is you should be in a position in your life when you really can immerse yourself in the graduate school experience and take advantage of being in a different place, of being around the amazing faculty. Your colleague, your students are incredible. Getting to hear people who come speak on campus, going to field trips. Last night we had firm night here at Berkeley, where students got to go to firm night, and you want to be in a situation where you could take full advantage of it. The alternative is if you're not in a position because of your life circumstances, you maybe have families, you maybe need to work. There are ways that you should look at it. How can I still meet my goals by being in this graduate program? And we'll talk a little bit more about that. So that's sort of the when to go to graduate school. Then there's sort of the which degree program and school to participate in. And it's really important to think of these things as a combination: the degree, the program, and the school. Because it's the combination of those that you want to look at. And I'll give you an example, because you could look at health policy and management at Berkeley, and which is an MPH degree. You could look at Harvard School of Public Health in health policy and management, which is an MS degree, or you could look at an MHA program at the University of Washington, and you need to sort of look at them side by side and see, what are the similarities, what are the differences, how do they align with what I want to get out of my health administration related experience and the experience that I have already. You don't want to just do that on the surface. You don't want to go, oh, well, I'm interested only in MHA programs, and that's because that's all I'm going to focus on. And then you would eliminate a Harvard School of Public Health with a great program that's an MS currently. It's turning to an MPH, but that's an MS in health policy management. Or you'd eliminate a great Berkeley or UCLA, MPH in that area. So it's really important to look at the degree, program, and school in combination, and how that fits with your needs going forward. In terms of the degrees, in the short, which we'll look at individually, in health policy management, there's the Master in Public Health degree, which some schools, these are usually 2-year degrees if you're not somebody who is a clinician or has a previous advanced degree. If you have a previous advanced degree or a clinician, it can be a 1-year program in health policy and management. However, you do have to realize that in that 1 year, you do not get as much time to really take elective courses. You don't get to do an internship. There are many. You don't just get the 2-year period of really learning a lot about the field, and so you just have to realize that in this case, you're getting the credential, but you're not getting perhaps as much knowledge and skills. You may not be developing as many relationships and opportunities that you need. So back to knowing what you want to get out of it. But usually they're 2-year degree programs. Some of them are focused more on management. Some are focused more on policy. Some have different tracks. At University of Michigan, I believe you choose whether you want to focus on policy or management. At UC Berkeley, you get a good combination of both, and then by the electives and the internships that you take you end up specializing a little bit more in policy or management. An MS degree tends to be a more research-oriented degree. There's not that, it's, as opposed to a professional degree, which an MPH is and an MHA. There aren't that many MS programs in health policy and management unless you are interested in going into research, and you should really make sure that if it is an MS program, that the people that you want to work with, the employers that you want to go work for, will recognize that as a legitimate degree, which they would from Harvard, and are you going to get the knowledge and skills, etc., that you need. An MHSA is less common. It's a Master's in Health Services Administration. It's less common than an MHA, which is a Master's in Health Administration, but they could be similar. Again, you need to, what I say, look under the hood and really see what the curriculum is, who the faculty are, what are you going to leave with, what are you going to do afterwards. An MHSA tends to be at a place like Johns Hopkins that has that degree specifically. An MHA is more common. Some of the top programs there are UCLA, Michigan, University of North Carolina, at Chapel Hill, University of Washington, University of Minnesota. They have strong Masters in Health Administration programs. The difference between an MHA and an MPH in health policy and management, or an MS in health policy and management, it will vary by school. In some cases, an MHA might be a little more oriented towards management, corporate kinds of programs. Some people call MHAs as sort of MBA lights, but focused on health. In some cases, it might be very much focused on hospitals and large health organizations like health plans. In some cases, it might be focused more on a wide range of different health roles. I think that you can get strong knowledge, skills, credentials, relationships, and opportunities in any of these different types of degrees. I think then you need to look at the type of employer that you want to go into, and do they have a preference for the type of degree that you have. Also, over the long term, what kind of degree what kind of credential do you want as your calling card? In terms of an MBA, there are a lot of questions now about, well, gee, why do I need an MPH or an MHA? Can't I just get an MBA? Because what they're really looking for is people who have good management skills and good business skills. And many MBA programs do have more. They have certificates in health management, or they have tracks that are health management oriented, or courses. And I think there are a lot of different opinions that you will get about just getting an MBA versus one of the others. There are some people I've heard recently that say, oh, you should just get the MBA. That's really, since health is such a business, if you're on the management side, that you really want to have that credential. There are other schools of thought that say, well, but with the MBA alone, you may not get the same grounding and knowledge and skills around population health, management, public health, and the way that the health delivery systems and health plans and our whole health system is going to be more around health, population health management, and people who can be effective at leading that. Also, sometimes with the MBA, you may not get a diversity of coursework. You'd have to see, or a depth of coursework. You should look under the hood and see how many health courses are they offering. Are they oriented to the kinds of things you'd like to learn, or are they more about devices and pharmaceutical policy and those kind of things if you don't want to learn that? Also, the network that you get. In my case, I have both an MBA and an MPH, and I really value the MBA coursework and the business thinking and problem solving, but my network really came more from the public health side of things, and I really valued having that public health training in addition to the MBA. And there have been many situations in my life where I have had, I've introduced myself more as an MPH rather than an MBA because of the audience and how people might view MBAs. Sometimes MBAs are viewed as not understanding public health or health care, and sometimes viewed as being arrogant and wanting to come in and tell people what to do. But sometimes I put the MBA first because sometimes people look at the MPH and say, well, they don't really understand the full business aspect of thing, and they're too social justice oriented and not business oriented enough, and so there's trade-offs to both things. I actually think that the MPH MBA combination, if you want to be in health management, would be the strongest combination of all, because then you really have two credentials. You have an MBA MPH credential. For me, part of why I got the MBA is I thought, well, gee, if I don't want to be in the health industry my whole life and have something like an MHA or an MPH alone, this gives me the credential to be able to do that. It also kind of gives me access to a whole other network of people that have an MBA that are kind of in that world, and gives me some credibility with them. But as I mentioned earlier, I really wanted the public health, the content, the network, and the relationships there too. There's more emphasis on dual degree programs going forward. The challenge is that they oftentimes require even more experience than the MPH or the MHA programs do, and are perhaps in some cases even more competitive to get into. Another thing with an MBA is that in an MPH, that you have to see how well the schools are integrated and how much time you spend in each, and do you want to get your learning in a school of business if that's where it's based, or you want to be more in a public health school? So there are a lot of considerations. The MBA MPH programs now at Berkeley are only 2.5 years. You get the benefit of doing 2 internships and getting great relationships and contacts, but it's only 2.5 years, and so that accelerates. Normally it would take 4 years to get that kind of background. There's a lot of focus now on MPP, a Master in Public Policy, for people who want to know they want to be in policy and get the rigorous policy analysis, research, writing skills, and understanding that process. If you know you want to be in policy, you want those rigorous skills, you want those relationships, that might be something to consider. Having it in combination with a public health degree is a great combination also. You get the policy knowledge and relationships plus the public health. An increasingly popular one now is, because of the focus on building healthy communities and having more place-based solutions in health, is a Master in City and Regional Planning, because you learn how to plan healthy communities and the language and the relationships, the credibility with that world, but you also are able to have the public health background. Master in Public Administration on its own is something that some people get. In my experience, if you want to be in the public sector side, it may be a reasonable degree to go. But what I found at least in the markets I've operated in, which are in California and in Boston and some other parts of the East Coast, that the MPA doesn't carry as much weight in terms of health management as an MBA, an MHA, or an MPH, or a combination of those degrees. However, there is some exceptions. Like, as I mentioned, look at the school degree and program. The Wagner School in New York, NYU, is well recognized as an MPA that has good credibility and good knowledge and skills in the health management field. You could also get a JD degree if you wanted to be in the health field. A law, that's a Doctor of Jurisprudence, a law degree. There are some programs that are law and public health. You should really think about, do you want to practice law, or is that background really essential for the work you want to do in policy or different kinds of negotiations? And then many people get an MD degree now in combination with an MPH or an MBA. I think it depends. If you're somebody who wants to be a physician or nurse and you want to go down that path, I think you should decide, what do you want to get out of it? What do you want to do with it? Do you want more of an MBA to have a business background to complement your clinical and your health background, and to help you manage your practice, or a large organization like a hospital or a health plan more effectively? Or are you doing it because you really want sort of the in-depth public health perspective to complement your more clinical training, and you want to focus more on population health and prevention and policy-related issues? And then, so that might be the MPH. So you have to check that out and see you've got some time. Oftentimes people do their MPH while they're in their third year of after their third year of medical school or after a residency. And social work is becoming an increasingly important program. It's one in which you can either focus on direct service or policy and management in addition to public health, with a big focus on care coordination and on mental health and mental health integrated with primary care and public health. Social work, I think, is an increasingly important degree. So these are examples of which degrees that are out there, and multiple combinations. There's also a Master's of Journalism degree now that can be combined with an MPH. There's pharmacy. There's a number of ways to do it, which I think is great. You're in an amazing situation, and so I think the key, even more than ever, is to figure out, what you really want to get out of it, and then what you're going to do afterwards, and then see which is the best program, and also see how much you can invest. Also, thinking about which program, degree, and school to go into, hopefully the bottom line is you should get what you need, that you want to think about the school and the surrounding environment, about the kind of experience that you want to have, and both culturally and geographically, and you want to think about how much they support opportunities for your professional and leadership development. What I'm finding in the field right now is that employers are assuming that you have good technical skills and that you have good clinical skills, and what they're really looking for are people who, above the technical skills, have the ability to be an effective leader and an effective professional. They're looking for people who can navigate the politics of communities and the cultures and organizations. That can take initiative, that can lead teams, that can manage projects, that can do effective presentations, and that are good problem solvers. And I think the program should help you to get those kinds of skills and really support it, rather than just focusing on the academic technical parts of public health or business. I guess you should definitely think about, given your circumstances, whether you're able to do it full-time and really immerse yourself in the experience, in an in-person experience, which is still my bias, that you'll get the most out of your program. However, there are some full-time programs that could be that they offer courses in the evening or weekends that might help you to be able to work and do that. There are opportunities to do part-time related programs and or online programs. We have a great program at Berkeley, the online on-campus MPH program. It is not specifically in health policy and management, however. There are some courses in it, but you don't specialize in that, which I think you have to decide, is that important to you or not. University of Minnesota has an MHA program that is you can do part-time while you are working. One of my former colleagues had his organization pay for his part-time MHA while he was working. He did it online, but they also had in-person problem sets and case studies and projects that they worked on together in his region and did networking, and that worked out well for him. So you just have to think about what kind of didactic and experience that you want to have. I think it's really important. I'm biased. I run the Center for Public Health Practice at Berkeley, but I think it's really important to have strong internship and practical experience and career support. Many schools don't have that as a strength. So because that's where you're going to get a lot of your experience, your relationships, your jobs, those kind of things. And it's going to be a lot of work to get those things, so it helps to have some assistance. It's important to think about if size matters to you, and if you really like a large school with more and more students, maybe some of you that don't have as much experience, you would like being with other students that don't have as much experience. Some might like small, more customized. Diversity is an important consideration for you to think about. Depending on your background, is it important to have a really rich, diverse background to really learn the most about public health in this really increasingly diverse world that we're in? Or if it's not as diverse as you need to, are you comfortable with that? And are you comfortable with being a change agent around diversity? Then there are things like the approach to learning. We have a great maternal child health program here at Berkeley. It's focused more on people who want to do quantitative research in maternal child health. And there might be other programs that maybe focus more on the programmatic side of it. Our joint medical program at Berkeley has a great problem-based learning approach through a public health lens, which I think is really important in this day and age, that they come here and they get 2 or 3 years of their clinical training here, and then they go through a public health lens, they do a public health research project, Then they go to UCSF to get their clinical work on the units. You do need to think about the reputation and the rankings of these schools, although I do not put a lot of weight on the rankings. I think that I'd look more at the reputation of the school relative to the kind of employers and the kind of field that you want to be in. Obviously, cost and financial support are deep considerations. I strongly encourage you, however, not to choose a school just based on cost and financial support. You should pick the best fit school for you. Oftentimes, when you've been admitted to a school, they will find funding for you at the end before you come, or once you come. There's a lot of opportunities to find. I have multiple students who work for me and multiple things all the time that are coming up to support students. You want to think about the geography, and you want to think about, where do you want to live? What kind of experience do you want to have? Where do you want to work afterwards? And what the heck do graduates do afterwards is an important thing to consider. What do you want to do? Speaking of what do you want to do afterwards? So these are the different kinds of roles in health administration that people might go into, the different kinds of organizations. And so when you're thinking about what you want to do for a program, you might want to say, gee, am I somebody who wants to go into hospital and health administration or medical groups or consulting? Do I want to go in private industry, devices and drugs? If you want to be in private industry, devices, drugs, then maybe having an MBA be part of your training may be more essential, although I just had a conversation with one of our faculty today looking at a very prominent biotech company in our area that is wanting to have more MPH students and really support more of those. Do you want to work in the government? Do you want to work in a community-based organization or a health department? I mean, the cool thing here is there's so many different options that you can go into. A lot of people feel like health policy and management can be limiting to them, and they look at programs like health behavior, health science, epidemiology, some of those, because they think, well, that will help me be more focused on community or not just get typecast as administrator. But the reality is that there's a lot of ranges of organizations you can work on with content that are in health equity, or the type of area that you want to really be in. And most people in those other areas, they're going to get out and they're going to go into management within a few years, and so they're going to need the management and leadership skills. So the benefit of health policy and management is you can get that strong foundation, that credential to do it, and you can still focus on areas like global health or mental health or aging and elder care that might help you to be able to work on issues that you're passionate about. Or you can work in community health centers and work with underserved communities, but you have the skill in health policy and management to do that. So these are some kind of roles that people in health policy and management go into, the kinds of jobs job titles. There's a lot going on around project management, program management, people that are in strategy or business development, consultants. There's a lot of different kinds of roles, and so what you want to do is see, which of these roles am I interested in, and what are the knowledge, skills, credentials, relationships that I need in order to be able to be competitive to get into these roles. So I lay these out to you as far as the types of organizations and roles so you can begin to think about which you might want to do. You need to get more exposure and experience in these areas, and then decide which program will best get you there. Is it a dual degree in MBA, MPH, or is it an MPH, or is it a particular school with a combination of those degrees and programs? So we're going to go on to why health policy management careers, and then what you can do to be competitive, and then we'll have time for questions. The focus on why HPM careers is that there's tremendous community health needs, and there's a need for more leaders and professionals. It's a chance to really make a difference and do well by doing good. Health policy management is a rewarding field financially, as well as the opportunity to really make a difference. I'd say the starting salaries for people coming out of our Berkeley program in the health policy management field are probably from the mid-70s to the low six figures coming out, with the chance to extend far beyond that. One of my students who graduated 3 years ago just took a new job at a hospital with a starting salary of $135,000 per year, with a bonus on top of that. So you can do well by doing good in this field. These are some examples of Northern California employers. I know we may have people from all over the country. I didn't have time to list a whole bunch of national ones, but you can see, again, it's health plans, it's hospitals, it's community health centers, it's medical groups, it's a number of different kinds of things. If you do want to be in clinical care, there are different roles that you can go into. Everything ranging from a public health officer to a clinician or a medical director in a community health center. Somebody who just wants to focus on quality improvement. You can just be a better manager of your physician practice or your clinical practice if you're a PA or an NP, a physical therapist. You can be better at managing your complex business. Or you can just be a better, more effective clinician by having this kind of background. You can understand how things work and how to make change within the systems. So what can you do to prepare now to be more competitive? Graduate schools are really looking for these things. They're looking for people who have a strong statement of purpose and a personal statement, really well written, very concise, very to the point about why you want to be in that program, why you're a good fit, why they should choose you, and kind of where you're going with it. They're really looking for more experience. You got to have a solid GPA, at least above 3.0, although you could be admitted below that if you have other good things going for you. And more likely to be competitive is probably in the 3.2 and above, depending on the school. A GRE score is an important thing. It is an indicator in some people's minds, not as many anymore, that of whether you can do graduate work or not. You have to at least have a reasonable GRE score to be in the game. The GRE really is something that if it's not solid, just creates a little bit of doubt. Like, can this person do the work? But that's where if you have the experience, a good GPA, you've taken some courses in the areas that you're weak, perhaps on the quantitative side, you can offset that. You also they're looking for letters of recommendation, so you have to be thinking about how do I get a good letter from a strong letter of recommendation from faculty as well as from employers. And depends on the schools. Some schools look for 2 academic recommendations and 1 employer recommendation. Others look for the opposite, so it depends on the school. And what they're really looking for is how this program fits. How does this school and concentration fit with who you are, and are you a good fit for what they have to offer? They're also looking for diversity, and they're giving more weight now to what journey and distance travel you've taken to get there. So nobody has a perfect application on all these fronts. Admissions committees weigh the different factors depending on what's important to that school and program, which is something you need to find out. You should not hold back from applying if you don't think you're perfect in some of these areas, but if you have the chance to wait until you really are putting your best application forward in all these areas, you'll have a better chance of getting in. Speaking of getting in, how you can be more competitive is to do your homework on, and not only while you're in college to get a good grade, but do your homework on the programs and what they're really looking for and what they're all about. And you can do that by attending events that they often have. We'll talk a little bit about some of those. And you want to build relationships with people, do informational interviews. You want to be somebody who's known at that particular place so that when you apply, they know you, and they know that you know what you're getting into, and they know that you're a good fit and you're a good candidate. Important to strengthen your qualifications so that you're putting your best application forward. And you want to eliminate or address any doubt, as I mentioned, things like the GRE or not a good GPA, and you can address some of those things in your statements about, particularly if it was an aberration that one semester, like in my case, my grandmother died, one semester, and I got an incomplete in the class, and I had a little rougher time. And I explained that, and then I said I ended up doing better, next time around. Or those of you who took organic chemistry and got bounced out of your interest in medicine, you can explain that and then say, then I discovered health policy and management, and now I'm focused, and now I know what I want to do, and look at how my grades have improved. Look at the experience that I've had. You got to give yourself some time and make it a priority to do a good job on your graduate school application and to build relationships and to strengthen your package, your story. It's about telling your story. You've got to be good at being able to tell the story about why you're a good fit for that program and how your background got you to that decision and how you're going to contribute to the program and what you're going to do afterwards. You got to be good at that and packaging it in a way that somebody who's really busy and has a lot of other great candidates can have your story be compelling and jump out at them in order to help choose you. Good to get, in order to do that, to get feedback along the way from people who've been through the process, who know the process, who can give you some constructive criticism. And It's good to, can be a long and challenging process with some setbacks. It only takes getting into one school and the right school, and eventually I got a former student who ended up getting rejected, in her case, from medical school a couple of different times, but she stuck with it. She kept strengthening her qualifications, and she got into one school, but it's exactly the one that's a great fit for her, and she's doing really well and really loves it. And so same thing could happen with an MHA or an MBA program. Those are competitive programs, and if you get rejected, it may not be anything wrong with you. It's not anything wrong with you as a person or a reflection of your intelligence. It may just be not the right fit with that school or not the right time for you. So stick with it. And reapplication is not frowned on in any particular way, but they like to see that you strengthened your application since the last time. So what can you do now? And then we'll get to your questions. So what can you do now is, you can really learn and engage about the graduate school programs that you're in and degrees that you're interested in. And that comes into really being able to do pre-application, go to sessions like pre-application advising. We have those starting in October here at Berkeley. We've got, and we'll have a virtual one, I believe, as well. Go to prospective student conferences at Berkeley, October the 25th. We have a student and outreach conference for prospective students where you'll hear from faculty, from students, from staff about what it's like, what they're looking for, how to be competitive. Go to outreach and information sessions. Go to professional events that the school offers. Last Friday I had a professional event on storytelling, which is helpful for your application, and we had some prospective students there who networked with me. Meet with the faculty and program directors, tell them what your interests are, show them your background, ask them how competitive you'll be, meet with students and alums, and be part of summer programs that may be associated with these different kinds of graduate programs that you're interested in. It helps to also strengthen your direction and your preparation by doing some assessments about what your strengths are, what your values are, what you're good at, what you want to have come out the other end, and so that you know who you are. Get some coaching if you need to on these decisions and on how to prepare. Do work on test preparation. Have your statement reviewed, and MyHCN has coaching and statement review and some of these kind of services available that students have found and applicants have found to be really interesting and helpful. And do your homework on funding, so that there are a lot of funding sources out there beyond even the schools that you are admitted to that people don't take advantage of. And so the more you can do your homework on that and have funding, the better chances you'll get to go to the school that you want. So some of the things you can do now at Berkeley, we have a Health Career Opportunity Program. These are some of our Berkeley students in that program. And we have a summer research program. We have GRE support. We have an advising. We have a number of other kinds of things to help you to pursue and be competitive. And we connect with Stanford and many other programs to Stanford School of Medicine to help you go in that direction. Other schools of medicine and public health will have these kinds of programs too. Health Career Connection is a national nonprofit that I run, and some of you have probably been part of that program, that inspires and empowers you to get paid experience as an undergraduate or a recent graduate, which can lead to jobs, and it gets connected to our graduate school partners. These are many of our former interns. Of this group here, there are so many people who've gone to graduate school in public health or in medical school or in law. We have a Harvard MBA there in the front row. So being in programs like this can really offer an advantage to you. And here are some of HCC's partners. That you can see we partner with a lot of top schools, so being in these kind of programs and being in Health Career Connection can be a great advantage to you. The applications are going to be out in early November. My Health Career Navigator, continuing to read our blogs, our webinars, our coaching, and reaching out to other people on the website who've been to graduate school or are further along would be helpful. And then the next steps I'd say is just learn and engage. Really be able to do the things on that slide. Review our previous webinars and our blogs. Look for upcoming webinars that will be helpful to you. And then really importantly is to choose the direction that you want to go in, or figure out how you're going to figure it out. Get experience, define the knowledge, skills, relationships, credentials, and opportunities that you want to get out of a program, which should lead to your successful criteria, and then strengthen your candidacy so that you can make a well-informed choice, and then you can have the option, your option to choose which program is going to be the best fit for you. So I know that was a lot of information in a short amount of time, but hopefully it was helpful to you. We can have further dialogue now with some questions, and then we will have some further webinars. There'll be a webinar in a couple weeks with panelists who've gotten different degrees, some that have an MHA, some that have an MBA, some that have an MPH, and you can ask them about the different strengths of those programs. So with that, we're going to open it up to questions. And I'm back. Let me just pull up the questions that we have. All right. I'm going to stop sharing my screen here. All right, so let me pull up the questions here. Okay, the question we have is, I'm considering doing a certificate in the core public health essentials. If I wanted to apply in programs at UNC, outside of UNC, would this credential count towards an MPH in other institutions? So, yeah, the question is really, can you get some certificate that will count towards MPHs at others? And I think the answer is you've got to check that out. I think it's not as common for certificates, particularly from other institutions, to apply towards a master's degree at a different school, an MPH degree. But I think that might be more common, so it's important for you to check it out and see. But my guess is that it might help enhance your application to show that you have that. But it may not give you any credit. So you have to decide, are you doing it because you want the knowledge and the skills? Do you want the credential? And if it doesn't get you any kind of credit, are you still going to be happy with doing that? Next question is, what do you think is more important in choosing a school, best academic fit, or location where you want to work afterwards? I think that depends on you. I think that if it is a really good academic fit, and it's not in the geographic area where you want to be, what you might want to do is to then develop your relationships in the area that you want to work in afterwards. Perhaps some people, for example, they go from the West Coast to the East Coast for graduate school, and they know they want to come back to California afterwards, and so they might work it out so that they do their summer internship still in California, or a post-graduate fellowship of some kind to get them back into the network and back into organizations, or they do a class project or their thesis or something like that, working with people in Northern California area. And so if it's not the geographic area you want to work in afterwards, you just have to have the intention that you're still going to work hard to build that network that you need and those relationships with employers. Some schools are going to have a reputation and a network nationally. Harvard obviously is a name that carries. Minnesota, their alumni associations nicknamed the Minnesota Mafia because they have people that are so tight all over the country. Michigan has a strong alumni network. Berkeley's name, when I went to the East Coast to work, I had no problem with my Berkeley degree getting a job in Boston and having that be really credible. So you want to pick a school, I think, that if it's a good academic fit and not a good geographic fit, that the reputation of the school will still carry you back to the geography where you want to go, and you want to make sure that you're building those relationships to go back when you're ready. The next question is, you described an MHA as an MBA light to some extent. Is it a shorter program? I also heard that it covers medical software systems, which might make it stronger than an MBA for someone going into health administration. So again, the term MBA light was just sort of a word that some people refer to it as. I think it's really important for you to find out today, what the curriculum is like in these MHA programs. How much is there in terms of management? How much is it? They might have a lot of business built into it in partnership with business schools, or just have that kind of program. And the advantage of it is that you would learn these business concepts within a within the context of health and health management problems and decisions, and the kind of roles that you might want to be in, rather than learning about it in a business school context, which might not be as relevant. Some MHA programs, as well as some MPH programs, have partnerships where students can take business school courses. So, for example, here at the School of Public Health at Berkeley, people getting an MPH in health policy management, they still can take a negotiation class, a innovations class, a social sector solutions class, fundamentals of business. They can take courses that are not core courses in the business school at the business school still, and still get some of that benefit. So I think you really have to look at the degree and the school and the program to see. Your question specifically about an MHA covering software in the in the health field, you will probably get more health context specific knowledge in an MHA program than you might in an MBA program. But some MBA programs, they might have somebody who teaches, who's an industry professional or who's a faculty member who's studying health IT, and they're coming in to teach. So it really depends on the school and the degree and the program. So I think you got to do your homework on those things. The next question is it harder to get into graduate school where you went as an undergraduate? That's something that also I think depends on the school. In general, I've not heard that from my colleagues that work at public health or business schools, that they discourage students from their school. I know at Berkeley we have many students that were Berkeley undergraduates that are now in our MBA program or in our MPH or MBA MPH program. In fact, we know the quality of those students and the skills that they've had, and so that is definitely not a disadvantage. Some programs at the doctoral level, I've heard that people like you to go to a different institution because it gets you exposure in a different area, and it reflects better on the person who was your mentor. I mean, there's a number of things like that, but I think in general it's not a disadvantage to do that. If you're a UNC Chapel Hill undergraduate, and you go for the MHA program, you should find out from that school if they frown on that or not. But I would guess that in many cases they will welcome people back. So I wouldn't have that be something you avoid. Are there particular degrees that are better suited for someone interested in government healthcare and policy? I've been told that a JD is the best route for this. Well, first of all, I think you want to have an an MPH program if you want the health policy part of it for sure. That would have a policy focus and give you that background and content. Then you can decide. Some MPH programs themselves will be sufficient